York's classic rock, Q1043.
Good morning, Dr. Oz. I'm so full of questions. First of all, Happy New Year.
Happy New Year, Shelley.
And how are you doing? How are you holding up? Because it's every time I turn on TV, you're on Channel 5.
We're kind of say that. I feel like a big weight has been lifted off me. I got my vaccine last week.
Good.
And I must point out, by the way, it's very easy to do. There were no side effects. I felt great. All my colleagues who got vaccinated felt great. But most importantly, every day that went by after the vaccination, I almost imagined my cells taking this mRNA, making little bits of spike protein, tempting my immune system, getting me ready in case the real virus were to come in. And after about 10 days, 2 weeks or so, you're getting a lot of the benefits. So I'm getting close to that. You just feel like I'm back where I was before this all started. And I'm hoping that a lot of people, as we open up vaccinations this week, are going to rush down, get their vaccine, because the first one gives you 80% of the benefit. So as soon as you get that first one in there, you can almost count the days till you can start to feel a little bit safer.
Now, a few questions about the vaccine. When you get the vaccination, I know it protects you, but are you then safe to be around other people like your family that you haven't seen?
So,
or are you still able to spread it if you're exposed?
As always, you ask the hard questions.
Sorry.
There's no way to know that for sure. And here's why. When they did the trial, they gave 44,000 people the Pfizer and 30,000 people the Moderna vaccine, so 75,000 people roughly. And then they said, tell us if you get sick. And they kept track of who felt sick. But they didn't test everyone to see if they got sick. They just wanted to know if you felt ill. They tested you to see if you had COVID, if you were positive, et cetera. They figured it out. But they don't know if they're asymptomatic sick people who were spreading virus. However, I'll tell you two things that are important. First is that we know that people who are asymptomatic are less likely to spread the virus than people who are symptomatic. We know that from a study in Indonesia just came out this week. And they're actually 4 times more likely to spread the virus if you're sick than not. So that's a big deal. Second observation is that if you were vaccinated, you had far less disease. So even if you got sick, and very few people did, the illness wasn't a significant illness. That wasn't the case in the other group. So if you want to worry your friends and loved ones, get sick with COVID. So if nothing else, you're going to make them feel better because you're not suffering that. But I do believe, Shelley, I do believe that although it might take us a month or 2 more to figure it out, we're going to learn that you don't just avoid bad illness, you avoid all illness, that the vaccination reduces the chance of you getting sick. Therefore, you won't be contagious. Therefore, you can go visit loved ones that you've not been able to see for the past few months.
What about the new variant? What about the fact that this virus seems to be morphing? What are the I mean, there are no guarantees, period, but what is the likelihood that we find that the vaccine doesn't completely protect against the new variant and the ones that will follow? Because I'm assuming if it morphed, it's going to morph again.
Again, right on target. We're going to keep seeing morphs in these viruses. This is an RNA virus. It will morph always. It will continue to change. That's how viruses behave. They're not trying to hurt you. They're trying to live in you. So they keep adapting themselves to be able to reinfect you and get back into you. Now, to date, none of these variants, even though they're more likely to spread amongst the population, none of them are so different from the original COVID-19 virus that the vaccine won't recognize them. Remember, the vaccine is looking for the spike protein, looking for the little horns on the virus. So your body makes antibodies to that, and then whenever it sees any kind of a coronavirus, it immediately murders it, so it can't make you sick. So far we're good. One day we'll have that problem, but we don't have to worry about it yet.
And what are your biggest fears right now? Because the spread continues, the new highly contagious variant is out there and growing. What are your biggest concerns?
My biggest fear is that we don't give the vaccines out. We store them with a series of rigid protocols that don't make a ton of sense, and that over time, it will continue to hinder us from getting Americans protected. And I'll give you a good example. I got my first shot last week, so I got to count 21 days to get to the next shot. Well, it turns out that they're storing my vaccine in a freezer right now. That's right. Someone's not getting the vaccine because they're preserving it for me. And I would argue it doesn't make a difference if I get my vaccine in 3 weeks or 4 weeks or 5 weeks. That means just delay my next vaccination until you get more. Give mine away to someone today, so they're safe too. And we should just pass it along that way. And today, just before we started this discussion, I heard that there's more discussion on the part of the U.S. government to do just that, and that future President Biden is going to move in that direction as well. So it makes me feel like, people are hearing this argument, but we can vaccinate many more Americans over the next month if we act aggressively.
What happens? I keep hearing these high percentages or startling percentages of people who aren't going to get vaccinated. For example, in the FDNY, for example, healthcare workers up to a third. So what happens if that bears out and a third of people or more refuse to get vaccinated?
Well, a couple of realities. First off, I don't tell people who want to delay their vaccination that they're bad people or foolish people. I say, thank goodness, because we don't have enough. So let someone else go first who wants the vaccine. That usually changes the energy in the discussion, because I'm not pushing you anymore. I'm just stating the reality that you have time. So now that you have time, draw a line in the sand. What would make you comfortable that you would get the vaccination? Is it 50 million people getting it before you? Is it your two closest relatives? Is it people in your neighborhood that you can interview? Tell me what it is. Tell yourself what it is, and then follow that guidance. If you decide, I want to see X million people get it first, I want to talk to one relative who got it, didn't have a side effect, then I'll go get it. Well, then when that happens, go get your vaccine. But I want to say something that just to defend those people. A lot of the folks who are denying the vaccine, like the FDNY people, are saying that I already had the illness. So I understand that you're theoretically saying I could get it again, I should get back. But, we have not had many people get COVID-19 again. And it would actually be unlikely if it's a common process, common event. I mean, it's rare. And so most likely, if you've had COVID-19, you've got a couple months to make this decision. So the FDNY was actually being brave. They're saying, why would we go first? Yeah, we're first responders, but I already had the illness. So why don't I go at the end of the line because I'm already protected for a few more months? That is not an irrational argument to be made. And I actually think that if I had COVID-19 already, I would have comfortably sat at the end of the line waiting for my turn so that people who have not been exposed, who are more at risk than me, can get protected.
I've been hearing that there's a possibility. I mean, I think I just saw it yesterday, that the new variant, I don't know the percentages, but people are coming up with false negatives. And I know people personally in my life who had all the symptoms of COVID. I mean, up and down the line, and then they tested negative. How big is this false negative?
The false negatives are relatively small. It's under 1%, I would guess, but it's there. I mean, it happens. Not every test is perfect. Sometimes you don't get a good swab. That was a big cause early on because you have to put that swab way in the back of your throat. You're basically going into your brain almost. And people don't want to do that. It's uncomfortable. And you have to leave the swab there 10 seconds. I had it done. I know I don't want to do that too often. But people, because they couldn't do it correctly, got inadequate samples. That led to a much higher percentage of people getting false negatives. But if you did it correctly, everything right, the test was a good test. Now, the other side of the equation, Shelley, though, was the false positives. And the head of one of the testing czar of the country, Admiral Brett Giroir, is a classmate of mine from Harvard. And he told me that at least 4 times more false positives than true positives in asymptomatic patients or people. So if I'm screening everyone in my studio, which I do, and everyone feels great, right? So they probably don't have the virus. Probably, we don't know, but they probably don't have it. If we test everyone, when we get our results back, if there's a positive, it's probably a false positive. It's probably not real, but you still have to deal with it. So it causes all kinds of issues, both directions. That's why being able to get past this by getting our vaccines and reducing the chance that you actually have the virus would help everybody.
You know that voice you're listening to. That's the famous Dr. Oz. What about vaccinating kids? What happens with the kids?
Yeah, it's going to be hard because parents aren't going to let their kids go into clinical trials. The vaccines have not been tested in kids under the age of 16. Kids are extremely unlikely to have any symptoms at all, and definitely are low risk of having major complications if they're otherwise healthy. There are some kids who have other medical conditions that, of course, puts them at risk. So as a parent and as a grandparent, I'm not pushing hard to get my 7-year-old granddaughter vaccinated because it's unlikely that I'm making a meaningful improvement in her care, in her quality of life. I would vaccinate her teachers in case she gets asymptomatically infected. And plus all these other theoretical issues that get brought up that I don't think are going to be panning out, but you don't know, right? Because the vaccine hasn't been around for more than a few months. So it'd be nice to have a few years of data before we start exposing kids to these things.
When do you think life will get back to normal?
June 11th.
June the 11th.
It's my birthday.
Ah,
I say that
wouldn't that be fitting?
I say that jokingly, obviously, but I gotta say, you've helped me before. We have our Big Kids Foundation Health Corps, which we've raised about $100 million to help kids learn about health and get them to go into health. So we have an annual gala. We're going to have it at the Central Park Zoo, and we're doing it in June. And I planned it in June because I do believe we can be outdoors and safe by June, and that we need to kick off Gotham again. We need to get the city back going, and someone's got to go first. So I'm going to go. Making sure everyone's vaccinated into a gala environment, which I'm hoping the city is still going to allow us to do. And I'm optimistic that that's going to sort of kick off, not just my gala, but June, the warm weather, having been vaccinated, that allows us to feel like we're back in life again. We took a year off. We learned a lot about ourselves. We did some things that hurt. We suffered, but let's get back. I mean, the war should be done by then. We should be able to re-engage each other.
What about wearing masks? How long do you think we'll be doing that? And will some people, do you think, just do it routinely? Other countries do in certain situations.
Right. I mean, people wearing, in masks in the subway is normal. And we used to always look at them and think, what's wrong with these people? But, they were probably right. The incidence of the flu has plummeted.
I was just going to ask you about what happened to the flu season.
Well, if you social distance and wear masks and wash your hands, you don't get the flu either. You don't get any virus. And we know from Australia, which is 6 months ahead of us, they had 4% of their normal flu volume. So I think that masks and hand cleaning are going to be part of our future. But I do think that the obligation to wear a mask, the concern that you're hurting others if you don't, will melt away. And I'm hoping this summer is a good time, especially if you're outdoors, for people to get comfortable not wearing their masks. It might take a few more months until enough people feel comfortable indoors. But I'm hoping by the time we get past the summer, people will get acclimated to not wearing masks. When we go back indoors again, when the weather gets cold again, we won't have to wear them. The COVID will not go away fully, but the ability of it to hurt you, especially if you've been vaccinated, should fall to a trivially low number.
After this, people get paranoid and they think, okay, once we get this pandemic under control, is there going to be another one? Is there going to be another new virus? What is the likelihood of that happening? Was this an anomaly, or is this our future?
Well, we're going to have more viruses. I think it's highly unlikely we won't. Hopefully they won't surprise us. Hopefully we'll be better prepared. This is a call to action to get public health back in gear. In this country, we fell way behind because it's not sexy. It's not cool. We're not curing cancer. We're literally watching people who are sick and trying to make them not get sick again. So these are all parts of it. But I tell you, a big part of the reason we got hurt is we're not a healthy nation. We have too many people who are overweight, diabetic, hypertensive, and those were the 3 risk factors that landed you in a hospital. And if you had 2 of those risk factors, 2 of them, the chance that, I'll say it differently, people who ended up in the hospital in New York had 2 of those risk factors or more. I mean, it's like stunning that was that common. It wasn't just one, at least 2 of those risk factors. So we can do a lot to keep ourselves healthy so that if we do run into a virus in the future, it can't do what COVID-19 did to so many.
But the irony in this is that more people are gaining weight because of the pandemic, the COVID-19.
It's both sides, Shelley. I mean, there's a COVID-15, right? That people gaining the weight, but there are a lot of people who lost weight. I personally lost weight. I'm in the best shape I've ever been in my life because I can't leave my home. So I go to the studio 3 days a week and I don't go anywhere else. I don't go out to parties. I don't go to restaurants. I'm not bungee jumping. I'm not.
You used to do that?
No. I mean, they did the other things, but I'm not jumping into pits, mosh pit diving. The things that normally we would do that would take up so many hours of our day are gone. The roads are empty. So I think that a lot of folks have taken advantage of it. If you haven't, you've got a few more months. Get in good shape. Our System 21 plan that we just launched is a good way to do it. I've got free videos on OzTube, which is droz.com. I've got a lot of stuff for you. So does everybody else. Go take advantage of it. Make yourself better. While you got time, because when we get back into the saddle again to go live life, it's going to be busy.
If you had one piece of health advice to make your life, our lives, healthier, what is it?
Remember that we are the safety net for each other. Call someone you love and talk to them.
Okay, Dr. Oz, thank you. If you missed any part of this, download the iHeartRadio app. It is free, and my podcast is Sonstein Sessions. And I'll see you guys tomorrow morning on the Jim Kerr Rock and Roll Morning Show, Q104.3.
New York's classic rock, Q1043.